Hi, everyone. Welcome back to our fifth session on relationships. I hope you all enjoyed our last journal prompt on senses, and I'm really excited to get into this conversation today. So, I wanted to frame the conversation of relationships around social support because we all find support through different avenues within our lives. And I think it's important to understand the impact of social support, especially when diagnosed with cancer and enduring subsequent cancer related treatment. So, according to the American Psychological Association, social support can be defined as the provision of assistance or comfort to others, typically to help them cope with biological, psychological, and social stressors. Support may arise from any interpersonal relationship in an individual's social network involving family members, friends, neighbors, religious institutions, colleagues, caregivers, or support groups. So there's access to various forms of support, which allow a survivor to feel valued, accepted, and understood. So there's a lot of research on the impact of social support on quality of life. So having social support following a cancer diagnosis and cancer-related treatments has been shown to improve quality of life and life satisfaction among survivors. However, when an individual has too much social support, it can actually harm an individual's quality of life and life satisfaction due to a loss of independence and roles within a relationship. A strong predictor of social support received is based on an individual's personality. So, those that are more willing to ask for help or seek out avenues of help within their life are more likely to receive greater social support compared to those who may have difficulty asking for help or seeking out assistance from others. And then another interesting point to note is that individuals who are newly diagnosed within that 4 to 12-month range are more likely to receive greater support from peers compared to those who have been diagnosed for 2 to 5 years. So, what is occupational therapy's role in promoting social support? When an individual is faced with a diagnosis, oftentimes their inability to participate or their decreased participation in supportive peer and family relationships impacts their self worth, their confidence, and their meaning, leading to increased symptoms of anxiety and depression. So, as an OT, we can address this with patients by incorporating modifications and adaptations, which help to increase participation while also collaborating on strategies for finding social support within the community. From my research, I found that locating avenues of social support, especially in the Pittsburgh area, tends to be really confusing and difficult, and it can become very overwhelming if you're not sure where to look. So, having an individual help to guide you through this process can be really important in finding those avenues of support that will be beneficial to you. So that leads us into our next journal prompt, which is tell me about your family. So this could be your mother, father, husband, wife, children, grandchildren, nieces, nephews, whatever you would like to reflect upon. And as you're reflecting on your family's roles, I want you to think about your most important role in life. What about this role is significant to you? Has this role changed since your diagnosis, or have you taken on a new role? So go ahead and begin journaling on this prompt, and I will see you back here for our next discussion on relationships. Have a great day.